Hello, everyone. I want to start by extending a hearty welcome to all our candidates and potential candidates who are joining from all over the world. Thank you for taking the time and the interest, hopefully not just to watch, but also to actively participate in the presentations. My name is Alicia Banfield of Banfield's Professional Medical English, or less of a mouthful, promedicalenglish.com. I have been a premium OET preparation provider since 2018, and since early 2020, I have been one of the all-star premium providers. And the theme for this candidate event, You Are Prepared, is especially near and dear to us at BPME because we like to talk about 360 preparation of the candidate. That is, yes, they're familiar with the OET subtest. Mandatory, absolutely, they have to. They have to be aware of the layout, the format, the skills that the examiners are looking for in each and every part of the test. Then it's the language skills themselves. They have to have excellent all-round English understanding and communication skills. Then there is, of course, test day procedure. They should have what we call the paperwork in order. What documents do they need? What pens and pencils and what they shouldn't have with them. And the venue. If at all possible, we kind of preach, see if you can get to your venue, at least to see it before test day. So on test day, being lost is not one of your problems. But then there's also the candidate themselves, their mental and physical condition. Again, what I call getting your head right. That is, don't go into your exam hungry, tired, panicked, or otherwise frazzled because you are not going to do your best. But today in this presentation, I am going to be focusing on language skills. You see it highlighted here in green, and a specific part of the language skills, namely interprofessional communication. And by that, we mean communication among doctors, nurses, physiotherapists, occupational therapists, pharmacists, dietitian, basically all of the healthcare professionals who are caring for the patient. Because OET reflects real life, and in English-speaking cultures, the health culture is such that healthcare professionals collaborate very much as a team. And for this reason, the health culture may possibly be a little bit different from the culture of different backgrounds, where in some other cultures and settings, there's more of a top-down mentality. By that, we mean that healthcare providers are simply there to carry out the doctor's dictates. Or you may be more familiar with a situation where the patient decides that they need a specialist, and then they communicate, find the specialist, and do all the communicating with the specialist themselves. In the English-speaking health culture, the drive is more towards a mutual understanding that all are important. They work as a team to care for the patient, and that communication is not always according to that traditional or rather old-fashioned hierarchy. What this means is that there is an increase in communication possibilities that can occur, not just in real life, but also in the OET as an extension. So what kind of scenarios are we talking about in this interprofessional communication? Here I've divided it into clinical and non-clinical. So in the clinical, we have, for example, ward-round handover issues, transfer of professional care. And by that, it could be that the patient stays on the same ward and a new specialist team takes over. It could be that they move from one specialty department to another, or it could be that the patient moves institutions entirely. There is the informal request for opinion or assistance. We're very familiar with this. One colleague may say to another, oh, I have a problem doing this with this patient or for this patient. What do you think? And it could be, yes, nurse to nurse or physiotherapist to physiotherapist, but it can also be between different professions. And then, of course, there's the more formal request for assistance or management of the patient, and we see this mostly in the writing subtests. Amongst the non-clinical scenarios, then you have things like protocols for patient or caregiver handling, updates on seminars and other CPD, that is continuing professional development topics, employment and change of department issues, ward or operating theater issues, laboratory, outpatient or medical technology issues, excuse me, staffing management situations, or care outcome issues, that is the overall institution disease profile and the outcomes overall that they get with their patient care. Now, most of these have the listening B and reading B in common, but you will also see little stars besides some in the white section below here, where these topics are also very common in the listening and reading part C, talking about caregiver handling, continuing professional development topics, medical technology, and care outcomes. So in your preparation, you need to be or to become confident in the language of all of these scenarios and more. So we all know the usual traditional hierarchy of communication and language of communication. So you may have, for example, a doctor saying to a nurse, arrange for this test to be done, put up an IV on this patient. Or you may have a nurse saying to a physiotherapist, we need you to come and see this patient. Here, the language is very direct, it's very clear. However, because of this interprofessional exchange of information that's constantly going on, you can also expect other scenarios and also for the exchanges to have much more indirect language. So let's look at an example of a listening B type of scenario. Here we have a pharmacist who is contacting a doctor about a patient. The pharmacist says, you've prescribed ciprofloxacin tablets for Mr. John's urinary tract infection. He much prefers the liquid form of medications as he dislikes tablets. However, I want to raise your awareness that he also reports having to take theophylline for his asthma. And there is a potentially severe interaction with these two drugs to bear in mind. Now, we have here a poll question. What is the pharmacist's main goal? To the side of the presentation, you will see where you can enter your answer. So is it answer A, asking advice on dispensing a certain form of ciprofloxacin? B, strongly advising that the doctor change the prescription, or C, giving an update on what other medications the patient is now taking. And I'll give you 20 seconds to enter your answer. And hopefully you got B, strongly advising that the doctor change the prescription. And how do we know it is B? It hangs on the language that is used. However, and to bear in mind. The language that lies between that, between the however and the bear in mind, those two are like brackets, and it is telling the listener, look, this is what I want you to pay more attention to, or the most attention to. So yes, there's language in there like raise your awareness. And based on that, you might think, oh, raise your awareness means the same as giving an update. However, this is not the main goal, okay? Then you see language like potentially severe interaction. However, bear in mind, this is pretty strong language. This is not just giving information. This is seeking to guide the doctor. And yes, you see different forms of ciproflox being mentioned, but that is not the main goal. He's just mentioning that. Instead, he's focusing the doctor's attention on the second part. So the language here that the pharmacist used to guide the doctor is indirect, polite, and respectful, but is still, kind of advising in a way. Let's try another one. In this scenario, which is slightly different, an occupational therapist and physiotherapist are collaborating on the care of a patient. The occupational therapist says, excuse me, at your next appointment with Mr. Roy, could you, meaning the physiotherapist, also elicit how he's managing with the grab bars and other aids I initially put in place in his apartment? Does he still need them all? Do we need to swap them out for others? I'll check in with him as well, but since you've noted that he's gaining more strength and dexterity on his right side, it might be good to revisit the issue more regularly. This time, here's the question for you to enter in the poll. The occupational therapist wishes the physiotherapist to do what? A, visit the patient more frequently at his home. B, physically examine the patient in more detail. Or C, talk with the patient about his coping and further needs. Take your 20 seconds. Okay, so we have a few different answers, but hopefully you chose C, talk with the patient about his coping and further needs. Now, here, as we said, it's a little bit of a different challenge. Here you are talking about a more unusual example of healthcare collaboration than you might be accustomed to in the practice papers you've done. Here it's not on the ward, but it's in the community. Then there is the grammar challenge. What is the issue that the occupational therapist is referring to? Are they referring to the patient gaining strength and dexterity on one side? Is the occupational therapist referring to the aids that are in place? Or is he or she referring to the physical examination or assistance that the physiotherapist is giving? But in this case, it's about talking with the patient about his coping and further needs, because it hangs on the vocabulary elicit and the idiom, what does revisit the issue mean? To elicit here doesn't necessarily mean doing a physical examination, and to revisit an issue doesn't mean a physical visiting. So you see why understanding not just grammar, but vocabulary and idiom is also important in understanding the whole of a communication. So, important in ensuring that you are prepared is, yes, to do tests, but not only practice tests, because remember that conquering a specific test paper only helps you conquer that specific paper. To tackle any paper, you need that wide range of vocabulary, grammar, but also understanding of English idiom and the nuances between interprofessional communication, that reading between the line. So a tip is to think practically about the situations mentioned in this presentation and to think about what challenges you would have with the language and if you would be comfortable in listening, reading, speaking, as well as writing, irrespective of the healthcare scenarios involved. So thank you very much. I hope that you participated, that you got the right answers. If not, that at least you understood now the different way of thinking about interprofessional communication.